everyone, and hello Jared. Thank you so much for joining me today for the latest patient perspectives as we highlight patient voices and the impact that genomics is having in patient lives. Today we're joined by Jared Griffin. If you could just introduce yourself and tell us a little bit about what you do.
Yes, so I'm Jared from Annabelle's Challenge. I run the charity. I set it up in 2013, and we support people with Vascular Ehlers-Danlos Syndrome, or Vascular EDS for short.
Your daughter Annabelle was diagnosed with Vascular Ehlers-Danlos in 2012. Would you ever just kind of tell people a little bit about what the condition is, for those who don't know?
Yes, so it's a rare genetic condition. We estimate it affects around 740 in the UK. We're aware of 300 on our database at the moment with it. It's a connective tissue disorder. COL3A1 gene is the one that's affected by it, and there's a 50% chance of it being passed down. But in our scenario for Annabelle, it started off in her as a mutation.
So when did kind of Annabelle first present with symptoms?
Probably since she was born, we've had issues, but the one thing that was more prominent was the easy bruising, but unexplained bruising. So you could touch her, for example, changing a nappy and leave a handprint, which clearly was very unusual. But it was the unexplained ones where you'd literally see a bruise and have no reason for it to be there. Skin tearing quite easily. And over the years, her pain threshold seemed to be different. So she'd have say, a gash to her head and just not feel pain from it. So we knew something wasn't right. And because we've got two older boys to compare with and we didn't have those issues, we knew there was something there with Annabelle.
And what was the kind of process like for you and your family to try and kind of get that diagnosis? What was that journey like for you?
3 years before we got the definitive answer to the questions, if you like. So at the start of the process, it was suspected that she'd got von Willebrand's disease, and that's the path that we went down in terms of care and looking out for him. We assumed at that point that was it. It was just von Willebrand's, and let's get on with life. But it was only sort of 3 years in that indications pointed towards vascular EDS as being a possibility. And subsequently, she was diagnosed in December 2012.
Were there any sort of kind of specific tests that you remember that were kind of undertaken at the time?
I remember vividly the skin biopsy that she had as part of the genetic testing, and that was an experience for her. It was painful, but for me to watch her going through that wasn't nice. But I said to her, we need to do it to get an answer to what's going on with you. But at that time, I thought, is this going to come back and it's not that condition, and then we've got to carry on down the journey of looking for answers? But it turned out that it was vascular EDS.
How did you kind of feel kind of getting that diagnosis? Because I suppose like before you said that they thought it was something else, and then now they're kind of giving you this diagnosis. So how did you feel at that time?
On one side, the sort of negative side is when you look at what the condition brings with it. It's almost like living with a ticking time bomb, not knowing when something medical is going to kick off internally, and ultimately, will it take somebody's life, which it has done. But on a positive note, you've got an answer. You can then put things in place. You can manage with the condition and live with it. So that was the bit I got from it, is actually, as even the consultant said, it's the same Annabelle that walked into the room 30 minutes ago that you're going home with. You've just got to manage what it's like living with vascular EDS, and that's what we did.
And what was kind of, when you obviously got the diagnosis, what was known about vascular EDS at that time? And kind of how did you have to then educate yourself to kind of become familiar with the condition?
Sort of very little known in terms of the obvious route to go down is Google, and then you see all the horrific stories that are there. And we did that during the diagnostic phase, so very frightening experience. And I would think for any individual going through the diagnostic phase, that's probably the most concerning and upsetting period of time. I think post-diagnosis, you get to adjust to having that condition, but I think it was very little known. So we reached out with Annabelle's Challenge as as a thing for Annabelle, really, just to build up a picture of what it's like to live with it. But then people reaching out who also got the condition, we then decided we need to raise more awareness and get more out there on the condition.
What kind of support did you receive from like the clinicians and doctors at the time, just to try and kind of understand the diagnosis?
Well, from the EDS service, great support, even to this day, even more so now. That bit was absolutely fine, and this is what it will be like living with the condition, the precautions that you need to put in place. We reached out to EDS Support UK at the time, but they more predominantly focus on the more common type of EDS, the hypermobility side, and vascular was, a very small chunk of what they did. And I think soon after we realised that we needed to set up something that really just focused on vascular EDS on its own, and that's what we did.
So you set up Annabelle's Challenge in kind of 2013. What was it kind of like launching this charity, and what was the whole kind of journey like for you, and were there any kind of challenges at the time and kind of now as well?
Never intended to be a charity. It was always at the start, raise a bit of awareness, focus on Annabelle, because it's our daughter, and let's do Annabelle's challenges. Growing up with Annabelle and what that looks like, but within sort of 6 months, a good friend of ours said, I think there's more to it than this. There's a lot of people reaching out to you now across the globe with the condition, and that sort of following was building and building. So we decided that we'd go to the press with vascular EDS and what Annabelle's Challenge at the time was, and it just sort of kicked off from there. And a year later, we became a registered charity, and it was non-intentional, but I think because more families were then getting involved, it just felt the right thing to do. And then we moved away from it being all about Annabelle, and actually it's about the people out there that are living with this condition. And if you like, the direction changed, and we then became the UK charity for it.
Yeah. What are some of kind of your favourite success stories from kind of since you launched Annabelle's Challenge?
Quite a few. I think working alongside the EDS service and the relationship that we've got with both the clinics has been a great success story. All the volunteers that support the charity and work with us, and the families that have got the condition, which ultimately got us the Queen's Award in 2018, to where we are today with the vEDS support programme that we've launched and research projects. So it's been building at quite a pace now.
Would you be able to kind of discuss a little bit more about the EDS kind of diagnostic service and the kind of work that you do with them?
Yes, so we jointly hosted a conference back in 2017, specifically for vascular EDS with EDS UK, and it was our EDS service that provided the talks and the genetic counselling sessions at that conference. We had about 40 families attend. So it was the biggest first ever gathering of people with vEDS and their families that had ever been undertaken. And I think from there on, things started to change in terms of what the families wanted in terms of support. The EDS service was very much involved with that process. To where we are today, where at our Sheffield clinic, I'm based in the joint EDS service clinic, so that when patients go for their cardiology appointment, they then, after that appointment, can come and see me and have like first-hand touch with Annabelle's Challenge at the clinics. And we're planning our next conference for next year. So both clinics we work really closely with.
Yeah, I mean, you also launched a kind of campaign called Reds for vEDS. Would you be able to kind of discuss what that is for people, and also kind of what made you want to launch that as well?
Yeah, so 2015, somebody with EDS, hypermobility, reached out to us, Evie from Ireland, and said, I'd like to do something and work with you on coming up with a campaign. She personally has experienced somebody passing away with vascular EDS, so that's where the sort of the connection came in. And after much debating on what that looked like, this simple hashtag came out, and it was hashtag Reds for vEDS. Because back then, as it is today, if you use that hashtag, we can follow people's posts and reshare those pictures to try and just raise a bit of awareness and turn the world red for one day. But over the years, it's just continued to grow right across the world to literally now the full day, the amount of pictures that are getting shared and money that's being raised off it as well now, which was never the intended plan, but it's actually become an annual fundraiser. So it raises a lot of awareness for the condition, brings people together, and it's their day, which is on the third Friday of every May.
So see this kind of money that you then kind of fundraise, where does that then go? What kind of work does that go into?
It helps us fund the support programme. So we've got helpline, we've got patient coordinators, we do ambulance marker setups for people and help liaise with GPs. So it's like the vEDS support programme in its entirety, but also research. So we've funded some research out of the Northwick Park Clinic. We've got more projects down the line. So it's basically the two things where we support families, it helps fund that, but also now research.
Would you be able to just kind of discuss some of the research that is kind of coming up? Yeah,
so we funded the Northwick Park project. That's opened up some sub-projects in terms of looking at pregnancy and the effects of vascular EDS there. We got involved with a psychosocial study that was done by a student genetic counsellor, which has just been finished in the last year. We've got one currently that's going on with student genetic counsellors. But a big one that we're getting involved with from trying to recruit into it is a clinical trial that's coming up in 6 months, which is, it's not funded by us, it's a pharmaceutical company that's behind trialing a new drug, but we'll help with the recruitment of that with the database that we've got.
What kind of clinical trial is it, and what kind of drug are they exploring compared to what the current treatment is as well?
Yeah, so the current treatments are beta blockers, which is losartan and celiprolol. The new one is potentially going to stop what could be causing the effects of vascular EDS. It's already been used for other conditions, and so it's already had a trial with 3,000 participants. So when this trial does start, it'll be at phase 3 on a drug that is safe. We just need to now, it's working well in the mice models. It's hopefully if they can get that to replicate in humans. So very promising signs from study point of view. Children will be able to participate. It's a global trial, so the UK can be involved, and we look forward to it.
What has it been like for you kind of working across the whole kind of span, I suppose, from like obviously with the patients, but then also kind of work like helping with the kind of the research and working with the kind of diagnostic services as well? What's that kind of been like for you, and what have been the kind of challenges of that as well?
For us, and something that will never change, is what we put in as an aim from day one is to support families, and that'll never go away. In fact, we'll always look to try and improve what we do to support families. So that's first and foremost what Annabelle's Challenge is all about. Research for us was always a back burner because we always knew it was big investments and a lot of hard work. But over the last 2 years, suddenly research has really crept up, caught us out really, because we had like 3 and 5 year strategic plans, and research was always at the back end of it. One, because we wanted to support the families first, but now over, like I said, the last 2 years, research is really kicking in, and for us, the big ticket clinical trial one is great, but also the smaller ones that are looking into what it's like living with this condition, the psychosocial issues, if you like, the day-to-day stuff. So it's great having the big ones to hopefully find a fix for vascular EDS, but also the low-lying fruit where we can try and help improve people's lives right now.
Yeah, no, I agree that they're definitely really, really important. What kind of support has this charity provided you and your family with trying to kind of cope with the kind of diagnosis and also just kind of living with it, as you said, day to day?
I think for us, it's being around others that are also affected, so we don't feel alone. I think that's one thing that was quite humbling at the start. So we never intended to be a charity or a patient organisation. It was just an awareness project, if you like. But with so many people reaching out in the early days, it was like, wow, we're not alone. So we felt comfort from that. But then I thought we had a duty to take this forward and change what we were doing, and then ultimately become the charity for the condition. And I think it's the support that we get back from the people that we support. It's really bizarre. It's we get a lot of comfort from that, and it helps me and our family and Annabelle, knowing that there's others out there that are in the same boat, and we're just the ones that are fighting for it.
And have you kind of seen like a kind of a global kind of involvement from people across the world kind of reaching out to you?
Yes, we have a big following from the United States, very supportive following, both engagement, awareness, fundraising. We're looking after Australia now, so we've teamed up with Medical at Australia, and we treat them exactly the same because the programs are very, very, very similar. So we feel like we've got a little Australia bit, and we reach out across Europe. So whilst we're a UK-based charity, we very much welcome anybody across wherever they are. You know, we're all in it together, and our feeling is if we can find a fix somewhere, it will fix it for everybody with vascular EDS. So we treat it as one.
Since kind of launching the charity, but also with advanced technologies, have you kind of noticed that there is an improvement in the time to diagnosis? Because I know that is kind of a really big problem for a lot of rare diseases, but I don't know whether that's something kind of patients have like shared with you, or whether you kind of have seen that yourself, that there's kind of improved not only time to diagnosis but also in management of care as well.
Yeah, I think we've still got those individuals that are probably like now out their age 40 plus, not had an event, have got the condition of any rare disease, and until something happens, and then you start asking questions as to why it's happened, and then ultimately you get a diagnosis later on in life. But what we're seeing now, because the awareness has improved dramatically, and I think that is thanks to technology, our relationship with the two EDS clinics, that more younger people are coming through and being diagnosed, and the time it takes to get a diagnosis is much improved. So we're finding now that certainly on our database, a quarter of it is children that are being diagnosed. Which for us, with with technology that's out there, we've managed to adapt our programs very quickly in terms of, right, what do we need to put in place for school support for these children, and explaining what it's like living with this condition within a school setting. So, and online virtual support, which we'd never have thought would kick in, and certainly over the last 12 months has been really helpful.
What do you think kind of needs to be done to improve time to diagnosis for people with vascular EDS, but also what needs to be done to improve their management of care as well, not kind of after the diagnosis?
I think it's from our perspective, it's carrying on working on education and awareness so that we can catch people as early as we possibly can, because if anything, that a positive out of a diagnosis of this condition is then managing it. And that's what we do with families then, is hold their hand basically and say, this is what we need to put in place. You can live on, we've got people on our database age 60, 70 plus. Yes, we do lose people at a younger age, but if you can get behind the management side of it, and we can make precautions so we can try and avert medical events happening, that's key for us.
Yeah, I mean, obviously Annabelle's challenge is kind of focused on vascular EDS, but do you kind of work with other individuals and organizations with the kind of other types of Ehlers-Danlos syndrome?
Yeah, so we work really closely with EDS Support UK. So if we get any inquiries coming in and it's more about hypermobile EDS, we will then refer them back to EDS UK. Likewise, if they get an inquiry from somebody with vascular EDS or suspected of having it, that comes to us. Any of the rarer types, so yeah, we reach out to them if it's not vascular EDS. And then other type of rare diseases, if it ever does come our way, we then work with people like Genetics Disorders UK, that's becoming genes people, find a cure. So we will work with other organisations where we can.
Yeah, I mean, kind of thinking about it from more of a kind of the general kind of rare disease population, what do you think needs to be done to give rare disease patients, but also families, more support?
think if you've got a condition that has an organisation that represents that disorder, then that's the, if you like, the route to market in terms of a patient voice. And if that organisation's got a steering group, if it can survey its members to help engage the community, big bonus. Where that's not the case and it's a rare disease with no organisation, then it's reaching out to people like Find a Cure, genetics disorders, and you know, at least then you've got some way of getting in contact with people that have got genetic counselling support that can sit within Parliament in terms of trying to get rare disease high up on the agenda.
Yeah. And how do you think that we can kind of ensure that more patient voices are heard, and kind of where do you think that patient voices are kind of really important? Because I know that kind of people want like patient voices heard more within kind of the clinical trial area, like much earlier on, and areas like that.
Yeah, I think the biggest area of concern that we come across is awareness amongst clinicians in general. And I think that's for any rare disease, but in particular the one that we represent, it's sometimes you come across, yeah, I've heard of EDS, or you might have heard of EDS, but this is the vascular type, this is the worst type, life-threatening, it's different to what you've probably come across. So that's where you are lucky that somebody's heard about EDS within in a clinical setting. The biggest area of concern is things like in A&E. So with this condition being life-threatening, is that knowledge there and patients not being listened to? And I think as these younger doctors are coming through, it is improving, but we're a long way to go for the patient voice being understood. I think the way the NHS is going is getting better. So there is a realisation that the patient voice is very important.
Yeah, I mean, what is the kind of future for Annabelle's challenge? Like, what are you kind of looking forward to in the future that you're working on?
I think for us, it's continuing and where we can improving what we do to support families that are affected, to raise awareness amongst the healthcare setting and research. I think that the two things for us, it's support and research.
Yeah, thank you so much for joining me today, Jared. Thank you so much for sharing your story as well, and keep up the amazing work that you're doing at Annabelle's Challenge.
Thank you.
Thank you.
Hello everyone, if you enjoyed this video, then make sure you check out some of our other videos in our series by subscribing below or going to our website frontlinegenomics.com. I hope you enjoy.